Hi, I'm Marlise, a fourth-year medical student at Northwestern Feinberg School of Medicine. My co-authors are Lisa Mathey at Lurie Children's Hospital of Chicago and Heather Risser at the Northwestern Feinberg School of Medicine. Our research is called the Acceptability of Telehealth to Increase Access to Qualified Forensic Examiners, a survey of Illinois hospital administrators. By way of introduction, many U.S. states are faced with the difficult task of providing quality care to sexual assault survivors in a timely fashion, given the national shortage of qualified forensic medical examiners. In 2019, the state of Illinois' Governor Pritzker signed an act that brought in the Sexual Assault Survivors Emergency Act to provide all sexual assault survivors with access to a qualified forensic examiner within 90 minutes of arrival to a hospital. For hospitals unable to meet this mandate, they would be prohibited from treating sexual assault survivors and be required to transfer hospitals to a treatment hospital. Given the widespread shortage of qualified forensic examiners, many hospitals have opted out of providing care to sexual assault survivors due to their inability to maintain staffing levels necessary to meet the law's mandates. As a result, roughly half of Illinois hospitals plan to transfer some or all sexual assault survivors to outside hospitals, leading to decreased access to care for many survivors. The use of telehealth has been increasingly studied as a way to increase access to qualified forensic examiners in areas of limited resources, and this has shown promising results. Based on our literature review, we hypothesize that telehealth may be an acceptable method to supplement bedside qualified sexual forensic examiners in providing quality care to survivors of sexual assault while also increasing access to care. For our methodology, we sent out 2 surveys via Qualtrics to hospital administrators across Illinois responsible for implementing these mandates in their hospital system. Survey data was collected between October 2020 to April 2021. In total, 65 administrators representing 74 hospitals responded to the surveys. We also conducted in-depth interviews with 3 participants. Respondents represented hospitals from all regions of Illinois, with a majority in Chicago. Our key results were that hospital administrators want more qualified forensic examiners to care for sexual assault survivors safely and consistently. On average, hospitals would ideally want an average of 21.74 qualified forensic examiners. However, respondents had 5.4 on average and a median of 3 qualified forensic examiners, demonstrating a misalignment between ideal and current staffing levels. Most respondents report barriers to their ideal staffing levels. Most cited barriers are related to staff turnover, limited training opportunities, and limited staff interest in becoming qualified forensic examiners. The vast majority of hospitals, 97%, could envision using telehealth during the forensic sexual assault evaluation. Respondents demonstrated a roughly equal interest in utilizing telehealth in various stages of the sexual assault evaluation, including during the initial intake, obtaining patient history, during the physical exam, during the collection of evidence, documentation of evidence, follow-up of care, and review of cases, charting, and pictures after evaluation is complete. Barriers implementing telehealth include perceived patient discomfort and current legislative restrictions. Based on our survey, we have found that telehealth represents one avenue for alleviating staff burdens and to enable survivors to connect with qualified providers, increasing equitable access. This study has identified several ways to utilize telehealth, including increasing access to care, particularly in areas with a shortage of qualified forensic examiners, allowing for survivors to connect with forensic examiners before a transfer in order to hear about next steps and expectations, reducing stress on the survivor, allowing for backup coverage in cases of emergencies and schedule changes, allowing for real-time feedback and mentorship for less experienced qualified forensic examiners with more experienced qualified forensic examiners, allowing for more training opportunities via telehealth, which will reduce the issues of cost, distance of training, and time away from clinical duties, which are all barriers identified in our study. And it can also allow for hospitals to share cases, documentations, and photos on a secure platform, allowing experts to discuss cases with other experts from various hospitals. In conclusion, as states grapple with expanding access to services with limited staffing resources, telehealth provides an opportunity to expand safe and effective sexual assault service to children, adolescents, and adults and lead to more equitable access to care. Thank you.